All right, everyone. Welcome back to the Wilkes-Barre Connect Podcast. I am your host, Dan Kimbrough, and today we have yet another member of the inaugural Luzerne County cohort of the TechCelerator program. Our guest today is Angel Diaz Jr., who's a U.S. Marine Corps veteran turned health tech innovator and is the CEO and founder of Vital Health Enterprises. Angel, thank you for joining us today.
Yeah, thank you, Dan, for having me, man.
So tell me a little bit about yourself and your background.
So, a little bit about my background. I've been an entrepreneur since a kid, and essentially I joined the Marine Corps because I didn't have my head on straight. So I used it to, I would say, as a stepping stone and to become a man. And I fell in love with technology while I was in, became self-taught software engineer once I got out, everything like that. And I just fell in love with the world of tech and business after I got out. So anything from Bitcoin to Web3 to investments to how technology works and how AI is advancing.
All right, very, very cool. And so what brought you to the Luzerne TechCelerator program? I know this is the first year that they've done it here in Luzerne County. It's been in Lackawanna County for a couple of years now. How did you find out about the program and what drew you to it?
Yeah, so when I came up with the idea, literally about a year ago, I started networking with a few people, and then I ran into Ken, who pointed me in the direction of that program. So I'm like, might as well give it a shot. You get what I mean? So
that's Ken O'Krepke from the Ben Franklin Institute?
Yeah.
All right, very, very cool. And so talk to me a little bit about your experience in that program. And for those who may not know what TechCelerator is, maybe walk us through what the program looks like and what you got out of it.
So, I mean, that program, definitely the two mentors that I had, Don Webster and Larry, were definitely beneficial because I feel like they catapulted my business plan and everything that I'm doing and the connections that I made in there. So we got an angel investor because of the TechCelerator program. So
amazing.
Yeah, it definitely was an experience. You get what I mean? I wish it was a little bit longer, but at least we're part of an exclusive group that we keep in contact and everything like that.
Very, very cool. We interviewed Hunter Wazlowski and Nathan recently as well, and that's one of the things that they said is that they wish that the program was a little bit longer as well. So it's a good thing that they leave you wanting more and sort of setting you up in that right direction. So
Yeah.
If you would, let's switch a little bit. Talk to me about Vital Health Enterprises, and what is it that you're looking to do?
So honestly, tell you the reality is I'm trying to build the biggest tech company to come out of Northeast PA. So right now it's currently Comcast at around 131 billion. So Vital Health is the entire company itself. We have about 5 products we hopefully get to release in the future, but the Vital Band is the one that's going to take us off the ground. Being that life-saving medical device, potentially life-saving medical device, but also being that medical device that digitizes the entire healthcare industry and how we currently check into the hospitals and go around and work around in the hospitals and things like that.
All right. So talk to me, explain a little bit more. I've seen you present a couple of times on the program, so I know what you're talking about. But for those who may not know, talk to me about the Vital Health Band and sort of what was the inspiration for why you wanted to start this band and sort of how you see it changing the industry.
Yeah, so the inspiration behind it was basically I had an experience in the hospital where I wasn't given the proper time to recover. You get what I mean? So they kept coming in. Obviously, they can't check your blood pressure while you're laying down. So I wasn't given the proper time to recover. And I remember asking the nurse at the moment, like, wouldn't it be easier if you guys just received my vitals back at the nurse's station? And he went ahead and hit me with a yes. I asked for a piece of paper. I wrote the idea there. So the whole idea and concept behind it is to get rid of 3 devices and turn it into one. Meaning blood pressure cuff, pulse oximeters, thermometer, but also to get rid of all those cables that you hook up to just to monitor vitals. Because I feel like the technology is there and it's only going to get better. So why not? Somebody's eventually going to do it. I just did it first and executed on it first. You get what I mean? And eventually, I feel like once we get the buzz and the PR going and stuff like that, bigger people are going to start looking at us.
Okay. And so you're talking about a device that would, upon checking into the hospital, it'd be a wearable device, sort of like our Apple Watches and things of that nature?
Yeah, but we'll be considered a band. So we're not a watch or anything like that because we're not going to allow you to make phone calls. You can listen to music, but text messages, but we do plan on having a life alert feature that it's going to monitor your vitals, obviously, and whenever it notices either early sign of a stroke or heart attack, or you go into one, it'll call 911 for you. So it will give
Okay.
your location and all your medical needs and data and record and stuff like that.
All right. So outside of the hospital, it would work as well. So this isn't something that you sort of get when you check in. This is something that you invest in personally.
Yeah. But it'll be covered through your health insurance. So we plan on getting that certification to be able to reimburse our customers and stuff like that. Only thing you have to worry about most likely is the monthly fee, and that would be it.
Okay. And so how for the hospital system, I guess, how does that work then? What information are they collecting from this band, and how does that integrate?
So, I mean, it's collecting all your key vitals. You get what I mean? But we're also going to include a sweat sensor on it, which we're going to be the only wearable on the market right now with a sweat sensor on it. So,
all right, what will that do for us?
Yeah, that will measure your glucose and your hydration levels a lot more accurate. So if you go into the hospital, say for might be feeling lightheaded or something like that, well, when you put this device on, give it a minute or two, it'll be able to determine what your hydration has been like.
All right. Very, very cool. And so the hydration and all the different levels, where does this, I guess, in the process of being checked in the hospital and getting in that process, where does this speed up? How does this help out?
So, I mean, it eliminates the entire process. So you walk into the hospital, you check in, you put our device on, and then you're waiting in the waiting room to see the doctor, not to see the nurse to measure your vitals and conduct triage or anything like that. We're streamlining the entire process. You check in, put our device on, go from the waiting room to the doctor, and that should be it.
And what's been the reception? I know you said you talked to someone, and we know when you were there.
Yeah.
What is your discovery turned out and found as far as those who might be interested in things?
A lot of people want this. A lot of people want this on the telehealth side. So that's how we're doing this right now. That's going to be a key role because the VA especially is moving huge into the telehealth industry. So, but the biggest issue they're having is they can't collect patients' vitals at all. So you got patients who are 80s, 90s, can't really drive to these VA hospitals and things like that, but they still want to make it to their appointments. Maybe they just recover from a surgery or something like that. So with our device, they'll be able to connect to any telehealth app, not just the VA one, any telehealth app.
All right. And so through the app and then through the band itself, that check-in becomes a lot easier rather than driving to the VA or the hospital for that quick checkup to just run your numbers.
Yeah.
Hit the button on the band, it's sent over, then you can have that conversation from wherever you are at any location.
Yeah, exactly. I mean, you just give them permission to access the band, and they'll during the appointment they'll be accessing your vitals live.
Gotcha. Very, very cool. So you say the technology is there and the want is there. Why are you the first one to doing this?
I'll be honest, the competition is too focused on the consumer. They already have a market, they already have revenue and everything like that. It's not. I asked myself in the beginning, like, okay, how come nobody has done it? And it's just a matter of time. I mean, technology is moving fast enough, but this is just an area that it's not fully being overlooked, but it's not given. It's not being given the attention that it deserves.
Gotcha. Okay. And then there's a second product as well, the Solace that you're working on also. Talk to me about that one.
So Solace is an AI venting tool. We're not going to call it a therapist because essentially what we want to create is a friend that knows you, that learns you, but that is used as more of a therapeutic kind of way. So, and this is meant mainly for kids in high school and college and stuff like that are struggling. We include a good feature on there that's going to be called Memory AI. In the future, what we plan on doing is you upload memories like text messages, videos, old Snapchat, any type of data that you had with a person or a loved one that's gone. And AI learns how you used to communicate with that person, but it also learns how that person will communicate with you. And it would duplicate that type of same communication aspect when you're talking to it.
Oh, very, very cool. And so it's not just the Vital Band that Vital Health Industries is looking at, and sort of that data for the health and speeding that up, but also sort of being a companion model as well, for young adults to be able to sort of vent to and work through some of the stress that they have in their day-to-day lives.
Yeah, exactly. So that's what we're hoping to do with that.
All right, very, very cool. And where did the impetus for that one come from?
Honestly, it just came from the love from technology. So I'm constantly writing down ideas and things like that. And one of the things that I use personally is a lot of AI to communicate with. I use AI about 99% of my day. So I'm like, I mean, Let me dabble in a little project. I always start projects, but I only keep certain ones that I like to finish.
Okay. Very, very cool. And for those who are worried about sort of the data access on both ends, so you've got this wearable that has, access to my vital signs and all these different things, and an AI app that I'm sort of venting to that is learning about me. What are the safeguards that are put in place to sort of make sure that those who might be worried about those things, what's being done to fend that off?
I mean, we don't share any data that you guys don't allow us to. So if you guys don't give us
Mm-hmm.
permission, we won't share any data. So
Gotcha.
that protection of privacy, that we're going to be partnering with these healthcare facilities to make sure we protect our customers' privacy.
Okay. Very, very cool. And so so you've gone through the TechCelerator program, you've got an angel investment. What are some of the next steps? What should we be looking for out of Vital Health Enterprises? Sorry.
So honestly, right now we're in product development stage. So
Mm-hmm.
building the company, building these relationships, going on a little PR run, and the closer we get to the product, the more we'll start releasing out there. So we have something
Mm-hmm.
going on, which is the Vital Health Club, which is the
Mm-hmm.
rewards program side of the band. It's aimed towards a healthier lifestyle. You get rewarded for having a healthier lifestyle. Like we plan on including challenges like, hey, this month run 100 miles and you'll get a couple of free shirts. Or in the future, we plan on partnering with like the supplements company. Get 50%
Mm-hmm.
off your next GNC purchase or something like that. You get me? So
Gotcha.
that's the plan with the Vital Health Club, and that's what we're currently putting out there right now and focusing on out there.
Mm-hmm. All right, very cool. So creating sort of an online community of those who are interested in their health and building that customer base for so when the band is ready,
Yeah.
you have somebody to deploy it to. So awesome. And if folks are interested in getting more information about Vital Health Enterprises or learning about the band or Solace, how will they reach out to you?
So you can follow me on Instagram, which is VH_Angel_AG or at Vital Health Club 24. Either or those Instagram, or you could follow us on our website at vitalhealthenterprises.com. So you can easily follow our newsletter on there, roadmap update, and you can learn about our team and any future products we plan on developing.
All right, very cool. Well, is there anything else that I missed? Anything else you want to add in there at the last minute here, Angel?
No. I mean, we pretty much got everything.
All right. Well, thank you again for your time today, folks. This is Angel Diaz with Vital Health Enterprises, another graduate from the Luzerne County cohort of the TechCelerator program. And this has been Wilkes-Barre Connect. I'm your host, Dan Kimber, and we'll talk to you next time.
I'll see you there.